How's it going, class? This is John Wolf. I hope you enjoyed the video that I pulled. I hope that I captured your attention, and I found it really inspiring. I will be talking today, obviously, about nursing, and I hope you enjoy the presentation. We're going to talk about a brief description of what nursing is, just kind of a definition, just so we can all start from the same page, start from the so-called same sheet of music. And then we're going to move right into talking about becoming a nurse, what that takes, what kind of education requirements, what are the licensure requirements for becoming a nurse. Probably really a start to finish look at how one becomes a nurse. Then we'll move right into employment, where nurses are working, what kind of jobs they're holding. And then we're going to go into nurses by the numbers. All that really is we're going to look at some statistics and some data, look at pay, populations within the United States, of where all the nurses are kind of working at, where you have your high concentrations of nurses within the country. And we're going to move right into nursing level expert, just where you can kind of go in terms of mobility in your career, like where nurses can go after they spend some time within the industry. So to start, we'll just go ahead and define it. Nursing, according to Encyclopedia Britannica, nursing is a healthcare profession providing physical and emotional care to the sick and disabled, and promoting health in all individuals through activities including research, health education, and patient consultation. The big thing to know about nurses is they're healthcare providers, and their primary focus and goal is patient care. And how they do that is they treat patients in a way to maximize quality of life. So, for instance, to throw a scenario out there, let's say you're sick and you go to a doctor and you see a nurse. The nurse comes in and she's going to ask you how you're feeling, and she's going to take your vitals and all that stuff. And the way she's going to treat a patient is she's just there to basically do everything they possibly can to improve your, if you're experiencing pain, to help with the pain. If you're experiencing, other symptoms, they're going to do everything they can to make you better. Then they treat the patient. Whereas if a doctor comes into the room, their way of working with patients is they usually have great rapport and they work with patients very well. But when they attack a problem, they go straight for diagnosis. They say, "What's the diagnosis here, and how do I treat it?" So, and a good doctor, patient care is definitely a big role of his job. But in terms of how they treat, nurses go patient care first and quality of life first. Doctors, they want to fix the problem, and a good one still takes care of the patient as well. Now that we've talked about what nursing is and we're on the same page, we're going to move right into it. We're going to talk about becoming a nurse. How does one become a nurse? We're going to talk about the education requirements, and all that is the different levels of education requirements. So a 2-year degree, an associate's, an ADN is that entry level. Some positions in nursing open up right after that 2-year degree. And then you can go into it a little bit further. You can you have that 4-year degree, that bachelor's in science and nursing. And then everything after that is just more on top of that. You go back to school, you do a master's program, a graduate level program, and you get a master's. Also, one of the things we'll bring up towards the end of this presentation is nurse practitioners. That's also a graduate level or a master's level degree field for nurses. And then you have your doctorate level. You have your doctor of physiology and doctors of nurse practice. Those are both doctoral level education routes that you can take as nurses. And then you have your licensure. So there's that 2-part here. So you get your education, and then if you want to practice as a nurse, you still have to be licensed. So every state's different. The states determine who gets to become a nurse, what are the education requirements, what are the different they determine your scope of practice as well as there's that general governing body. Each state has a governing body for nurses, that board of nursing, and they determine all this stuff for you. So once you've got your education, you roll right into getting licensed. So you show up and you take a test and you become licensed. Once you're licensed, there is still for most states, there's follow-on training or training hours, number of hours that you have to do certain tasks in order to maintain your licensure within the state, in order to promote better practice and safer practices within the nursing field. Now that we have covered education and licensure, how you become a nurse, we're going to talk about where you can work as a nurse, employment. Big employers of nursing include general medicine, hospitals, and that includes surgical nurses. Those specialty services is your second. They employ, as per the table here, 59,750 nurses within the psych and substance abuse fields of nursing. And then you have outpatient care. Those are nurses where you go to the podiatrist, you'll see a nurse, or if you go to orthopedist, you'll see a nurse there as well. And then you have the home health care services. That's another 170,000 plus nurses that work at home health care. All those nurses do is they will show up to a patient's home and treat a patient within their own home. Sometimes that could include hospice or end-of-life care. Now let's talk about pay. So the bottom chart here talks about top paying industries, and it may look kind of confusing, but let me try to decipher this for you. If you look at accounting, tax preparation, bookkeeping, payroll services, you'd say, well, why would I need a nurse there? And why are they getting paid 90,000 plus a year? Like what is a nurse doing in that industry? And to break it down a little bit, all industries, especially high level industry, big level, big business, big corporations, big organizations, they hire nurses as well. A lot of those doctoral level nurses that have a larger background in education or administration, and they help these organizations understand nursing as an industry better. So you don't want a whole bunch of accountants determining pay stuff for nurses when they may not be the best suited to do that. That's why you have nurses working in those fields, and usually, like I said, there are those high level, those doctoral studies, the nurses that are employed in those, as well as, like, if you look at the bottom, you have insurance and employee benefit funds. That's the big thing there. Is insurers need to have an understanding of the medical field as well, and that's why they hire nurses, so that they know how to properly bill, properly compensate hospitals and nurses for their work. That's why they hire nurses there, as well as a lot of insurers offer nurse helplines where a patient can call a nurse helpline instead of going to the ER to kind of triage them before they just jump right into going to the ER. Now that we have talked about where you can work as a nurse, let's look at some of the numbers. Let's look at nursing in terms of the geographic location and numbers. On these two charts here, we have the mean wage, and then we have numbers per state here. And no surprise here, California is leading in both of these. There's a large population of people within California, and you think it's very... I'm not surprised at all that they also have some of the highest paid. For the annual wage is roughly 100,000. That's the mean for California, and you think of it as cost of living. In California, it is with real estate cost and all the different agricultural costs associated with living within California. You need to pay nurses more in order for them to be able to live and work within the state. And the other not big surprises here. Texas, another very large state, has large populations. They need nurses to support those populations. And then New York, basically, you have large populations of people, you're going to have the larger populations of nurses. Another one with Florida, it may not have the largest population per the U.S. In terms of cities and numbers of individuals, but you have to look at the high number of retirees that live within Florida. Now that we've talked about how to become a nurse, we've talked about where you can work as a nurse, we talked about how you're looking to get paid, what your average income is going to be, and where you can kind of work within the United States. Let's go ahead and talk about that level expert, where you can go as a nurse if you want to continue your education, or those top level nurses. Columbia Encyclopedia has written, while nursing as an occupation has always existed, it's only in fairly recent years that it has developed as a specialized profession. Now, nursing has been around for a very long time, and it wasn't until post-World War II that nurses really started to get into specialized fields, such as nurse anesthetists that help put people or patients to sleep for operations. You also have OR nurses that are sole job is to work in ORs alongside of surgeons. And you have so many different offshoots of nursing, and there really is so many places you can go within nursing, and that's really a modern invention or transformation of the nursing field. Some of those top level jobs within nursing include nurse practitioner. For those that don't know what a nurse practitioner is, it's simply a nurse that's usually a graduate level degree program that gives you a nursing practitioner certification, and they can practice medicine under their own licensure. So they don't need doctors. A lot of nurses work for hospitals, and ultimately doctors are in charge of their nursing staff, whereas a nurse can practice their own medicine. They can write their own prescriptions, which is a big deal. There's a lot of responsibility that goes along with writing prescriptions and being a practitioner of medicine. That's one of those high-level positions, as well as doctoral level nursing that we covered in those first couple of slides. One thing that I read during my research of this project is a lot of students, a lot of nurses have applied and got into doctoral level programs, and there's a large influx of people to go into these programs, but they're not graduating as many or producing as many doctoral level students as they need to be. And so the field in general, the industry that as a whole of nursing, has really been falling short of their numbers and needing those high level doctoral positions for nursing. And you may say, well, why is that a big deal? And I'll tell you this. The reason why you need these top level positions within nursing is they administrators. Let's talk about hospital administrators, usually at a doctoral level. Someone that is in charge of all the nursing staff in one of those nursing administrative positions holds one of those doctoral degrees. They're allowed to interface. They're in position to interface with hospitals in order to be that top coverage for the men and women on the ground in nursing. So they can really take care of those in the lower level of nursing, and they really help shield them from being taken advantage of, being given too many responsibilities, having their scope of practice be too broad. They really can sit there and really help the hospital better utilize those nurses. That's why it's so important for us to have those positions, and currently they're definitely experiencing some definite graduation shortages. So these positions exist. They're definitely there. They're definitely very rewarding. There just needs more to be done within those levels of nursing. Now that we've talked about our upward mobility within nursing, how far you can go with nursing, we're just going to bring it all back together. So today we talked about nursing as a general description. We all got on the same page. We defined it. We talked about becoming a nurse, the educational requirements. We talked about the licensure requirements to becoming a nurse, how one from start to finish becomes a nurse. And then we talked about employment, where you can work, what industries, what fields employ nurses. And then we talked about where they're located in terms of general population, geographic location. And we talked about what their annual their mean annual wage income is for those geographic locations. We also talked about nursing level expert, that last slide. We talked about how far you can take it, and we talked about some of the woes that those high level positions are experiencing right now, some of the shortcomings. I want to go ahead and thank you guys for taking the time to watch and take part in this presentation. I really enjoyed it. If you guys have any questions about what you've seen here today or some of the presentation, go ahead and message me through the classroom portal with College 101, and feel free to ask all the questions you want. I will absolutely try to answer them best of my ability. And thank you, and have a nice day.